Trepanation is a surgical procedure in which a hole is drilled or scraped into a human skull, thus exposing the brain to air in the belief that this will treat a wide variety of ailments. There is evidence that trepanation has been carried out since Neolithic times, and evidence of the practice has been found in cave paintings and at ancient burial sites. Those behaving abnormally might find themselves forced to have holes drilled in their heads in the belief that this will release the evil spirits causing their problems. It was also used as a catch-all treatment for seizures, epilepsy, and even headaches, and the small piece of bones that was cut out would usually be kept and worn as a lucky charm to keep evil spirits away. The practice seems to have been very common. At one 8,000-year-old burial site in France, 40 of the 120 skulls found contained trepanation holes, and in total 1,500 skulls from the Neolithic period have been found across the world containing the holes, representing as many as 10% of all Stone Age skulls. While it may sound bizarre, the practice did have some uses. Evidence points to it being used as an emergency surgery to treat head wounds, creating the holes to remove damaged pieces of bone from the head, and cleaning out blood which will often pool under the skull after a serious head wound, injuries that were no doubt common when weapons used were blunt instruments like slings and clubs. The practice seems to have been used all over the world. In ancient Greece, Hippocrates wrote specific instructions on how to carry out the procedure, and in the Middle Ages, trepanation was still being used as a general cure for health issues, treating everything from skull fractures to seizures. In a time before modern medicine and antibiotics, you might think that few survived the procedure. However, the majority of the skulls found with the holes show signs of healing, which suggests that the survival rate was in fact very high. Surprisingly, trepanation has not gone away, and it's still used to treat certain types of hematomas. There are even groups of people who practice trepanation today in the belief that it can increase brain blood volume and achieve a higher state of consciousness, as well as treat psychological ailments.